Welcome to Champions of Care, brought to you by Oakwood Healthcare. My name is Mary Zatina. Today, we're talking about women. Women are often the healthcare decision makers in most families. They take care of everyone's healthcare, but sometimes they take care of themselves last. Today we'll be talking about women's health issues, how you can stay healthy through all the stages of your adult life, and also you'll be curious to know how you can fix some of those health issues that trouble women that you may have thought, this is something I'm just gonna have to live with. Here with me in the studio to get us started is Dr. Karen Plymel. Welcome to the show, Dr. Plymel.
Thank you.
You are an Oakwood-affiliated obstetrician, gynecologist, and you have offices in Dearborn. Is that correct?
That's correct.
Great. Well, we're so glad to have you here.
Well, thank you.
Tell us in general, what are the kinds of screenings a woman should have annually, maybe more than annual, maybe less than annual, to stay healthy?
Okay. Starting off with, most people think of a gynecologist, they automatically think of their pap smear. So I'll start with their cytological screening, also known as an annual pap smear. We start now at 21 years old, and from 1 year beyond that point, every year annually. It's an excellent time to talk to women about sexually transmitted disease screening. We recommend mammograms starting at 40 years old, 1 to 2 years, and then after 50 years old, every year or annually. Colonoscopy starting at 50 years old, thyroid screening, lipid profile screening we recommend. Different recommendations. 45 years old is our typical, whether you, unless you have risk assessment or behaviors that make us think that you need it earlier.
And we refer to a physician like you as an OB-GYN. The OB is for obstetrician and obstetrics. That's the baby part, right?
Correct.
And the GYN part is for all the other stuff pertaining to a woman. Is that too simple?
It's not simple at all.
That's exactly
A
what
woman
it
has
is?
so many healthcare considerations. I think that's an excellent point. We do focus on OB-GYN, and we hear that terminology, we think automatically as obstetrician. We forget the gynecology and all the things of women's healthcare.
So if a woman is having a baby, there's a whole set of things that have to go on. But what are some signs that something may mean I need to go see my gynecologist before that annual physical? What might be a sign that something isn't quite right?
That's an excellent question. I think that anytime you have intermenstrual bleeding, bleeding in between cycles, bleeding after intercourse, you feel fuller than you felt prior to, you've noticed the changes in your waist size, specifically to the abdomen, notice weight gain, weight loss. Those are real tip-offs to come in earlier.
More than that once a year. And then, not that this would be relevant for me, I'm winking at you, but what about when you hit 50? Does something else kick in that we should watch for, or are those the same list of warning signs that I should make a visit?
I think what you're thinking about is menopause.
Why, I have heard of that for older women.
For older women, not you, of course, but it's menopause. 51 years old is what we typically think of as the average cessation of the menstrual cycle. Actually, it can become 5 to 6 years earlier. That's called the perimenopausal state. Your gynecologist should really start talking to you at that point, telling you the things to expect, mood changes, sleep deprivation, sleep alterations, the hot flushes that we're all heard of, we've all heard of. That's primary, I think, what you're thinking about at 50, 51 is that menopausal transition.
Well, are there some treatment options you recommend for managing the symptoms of menopause?
Lifestyle modifications. I think we always jumped immediately to medications, but simple things, wearing lighter clothing. Exercising has been proven to help with those hot flushes.
Really? Why is that?
But if the disruption of life is too severe, we would most often suggest estrogen if you're a good candidate for estrogen replacement therapy. And there's some alternative therapies out there as well. Some antidepressants, some anti-seizure medications, and there's some compounding pharmacies that make hormones specific to a woman's need.
Now, what would you say to a woman? What one thing do you wish women did to take better care of ourselves?
Listen to themselves, care for themselves. We get so busy nurturing everyone else, taking care of the children. I see this day in and day out. Women come to see me when they're pregnant. I have them during that small time of reproduction. I have them in those 40 or 41 weeks of life, and then I don't see them again. They get busy taking care of everything else. They forget their immunizations. They forget about their health. They forget to take time for themselves. Depression is a big factor that I see. Just exercise is often neglected. I think women neglect themselves altogether.
So
At one point I want to go back to, because I think I stressed the cytologic screening starting at 21. But you're right, we do start off from that point and work towards 65, 70 years old. But a primary setting we would like to have is having more adolescents come to us. The American College of Obstetrician and Gynecologists recommends that the first reproductive health care visit starts at age 13 to 15 years old.
So 13-year-olds should be making that appointment.
Absolutely. It's a strategic time to bring a young woman in to start talking about contraception, to start talking about their sexual behaviors, their sexuality, start talking about human papillomavirus, and screening them for that, talking to them about that, and just building that rapport well before you even have the physical exam. Because again, we get locked in, I think, over time in history. Gynecology means pap smear. That's not necessarily so anymore.
And you want to get them started young on a right and healthy track.
And I want to have them to have someone to come to that they feel comfortable discussing. We all know young girls need to have an outlet, and oftentimes the gynecologist can be a private place that they can come and bring things that they can't talk to anyone else or in another setting. So it's a great time to bring that person, again, before their physical exam, begin just to develop that rapport. They have a safe place.
Well, it's good to know, Dr. Plymel, that you are accepting patients, so if there's a young woman or an older woman watching, they can check you out on oakwood.org or call 543-WELL because you are accepting new patients. Thanks so much for talking to us today about women's health.
Thank you.
We're going to take a short break, and then we'll come back and we'll talk with the head of Women's Health Services at Oakwood about some breakthrough advances in treating some things that a lot of women might think they just need to live with. Stay with us. Want to quit smoking for good? Oakwood can help. Call our free Quit Smoking resource line to help you kick the habit. Whether you're interested in medications, online programs, group classes, coaching by telephone, or hypnotherapy, our health education specialist will be able to direct you to the Stop Smoking resource that best meets your needs. Start your journey to better health by calling Oakwood's Quit Smoking resource line, 313-586-4938, or visit oakwood.org for more information.